Hi, my name is Ayelet Kuper, and I'm a 2012 AMS Phoenix Fellow and a Thematic Grant recipient. As part of my AMS Phoenix Fellowship, I developed a conceptual framework for the knowledge beyond bioscience that was needed to train physicians to not only be experts in medical content knowledge, how the blood circulates around the body, where the knee is versus the elbow, and how they're made, but rather also to know how to be experts in advocacy, collaboration, scholarliness, leadership, professionalism, and communication. The other roles or competencies that we know that the public expects from our physicians and that are required for delivering compassionate, equitable care. In order to do that, I spent much of the time of my actual fellowship trying to understand what kinds of knowledge outside the biosciences, so largely from the humanities and social sciences, underpin these non-medical expert roles, and together with my colleagues developed a fairly sophisticated framework of content. The foundational knowledge we discovered is actually an understanding of what knowledge itself is, an idea called epistemology, knowing what knowledge is, the study of knowledge. That is, not just scientific knowledge that students can memorize, but other kinds of knowledge, narrative knowledge, patient knowledge. And then building on that, we came out of our research with an understanding of three fundamental themes that students had to understand: the concepts of power, justice, and culture, and really understand in a rich way in order to be able to properly serve their patients, and also in order to properly be stewards of our healthcare system. And so for my thematic grant, what I am doing is I'm actually implementing the curricular content aligned with this conceptual material into undergraduate medical education and postgraduate medical education, and perhaps the most crucially, faculty development at the University of Toronto. We are implementing material into the pre-clerkship, which is the first 2 years of medical school, where all medical students are together. And then we are implementing material into the clerkship, which is the clinical years of medical school, particularly during the time when medical students are on their internal medicine rotations. Finally, we're doing implementation in the residency programs in the Department of Medicine, where I happen to also be a doctor, and where the department is very excited to be teaching this material in keeping with their new strategic goals related to person-centered care and equity. And we are working both in our department and more broadly to support both postgraduate and undergraduate medical education to bring these ideas to our faculty, to promote rigorous faculty development, both just-in-time faculty development and the training of faculty champions for this material. We strongly believe, and by we I don't just mean me, but I mean my entire research team, that these are foundational concepts for providing equitable, compassionate care. I'm joined in this work by many other Phoenix Fellows, both from Toronto and from other schools in Ontario, and both from 2012 and from subsequent years. I'm also joined by various education leaders across the undergraduate curriculum at U of T and in the Department of Medicine. So we're doing our very best to try to bring to our medical students these important ideas that will allow them to be compassionate, equitable healthcare providers of the future.